Hello, everybody. My name is Sarah Sherman, and today I'm going to be talking to y'all about Parkinson's disease. I'm going to talk about what Parkinson's disease is, how it affects the body, and the treatments that they have for it out right now. In 2009, my grandfather was diagnosed with Parkinson's disease. He was a diabetic, he was in kidney failure, he had a stroke, and Parkinson's disease as well thrown on top of him. So his stroke and the Parkinson's had a lot to play with his weakness and issues that he had. And now that I'm in nursing school, I'm becoming more interested in it, and I like learning about it and how it would affect my patients, and if they can get better, and the things that I can help them do to regain their strength and get better. First of all, I'll explain to you what Parkinson's disease is. Parkinson's disease is a progressive nervous system disorder that affects many people worldwide. According to Parkinson's.org, more than 10 million people worldwide are suffering from Parkinson's disease. Parkinson's disease, what it does is you have these things in your brain, and it just doesn't, something affects them and it just doesn't connect. So your nerves and all that aren't getting the messages to move. I remember my grandfather would be walking and we would be walking with him and he would just stop because he just couldn't lift his leg. He couldn't get going. Some of the symptoms of Parkinson's disease, I have a visual aid here. If you want to see it. Of some of the symptoms that Parkinson's disease gives, if you want to look at them. In your central nervous system, it causes depression. Your eyes, it affects your mouth, you salivate, and the most prominent symptom is muscle weakness and tremors. According to medical news today, Parkinson's disease is being linked to Alzheimer's disease. Most patients that have Parkinson's disease have some form of memory loss, and it's playing a big role into trying to link the two together. Because there's a specific protein in the brain, it binds with microtubules, and when they connect, it causes neurological function. If it's blocked, if it's tangled up, that neuron doesn't get together and connect, and that's what causes all the memory loss and the issues going on there. There is no cure yet for Parkinson's disease, but there are a few medications that are available that are out on the market. One of them is called Requip or Repinerol, and according to the Davis Drug Guide, Requip helps bind those parts of your brain together, and it helps with tremors. So if you have a patient that has taken Requip, you should see some improvement with the tremors, and that'll help them as far as eating and getting dressed and all that kind of stuff. It gives them a little bit of independence to be able to help themselves. Another thing that is good for Parkinson's disease is exercise. Getting those muscles moving and working and building your strength, thank you, is good to Parkinson's disease. I remember my grandfather, he would have a physical therapist come to his house 2 or 3 times a week, and he would fight them with tooth and nail. He didn't want to do it. But after we noticed, after he would do his therapy, he would walk better. He would be a little bit stronger. And then the days that he didn't do it or didn't listen, he would, be really weak and not doing his best. And thirdly, the most important thing for people with Parkinson's disease is to be there for them, love them, and support them, because it's hard for them going through it themselves. But if they have someone there helping them or encouraging them to keep pushing and doing their exercises and taking their medicine, then their outcome is better. And my conclusion about Parkinson's disease is that it affects the brain, it affects the body, it causes muscle weakness, tremors, lots of other issues, severe salivation, depression, because if you can't walk and you have tremors and stuff like that, it can cause depression. And there is no cure for it, and they're linking it to Alzheimer's disease. And you can take medicine for it, you can exercise for it, but most importantly, if you have a good support system and people that help you along the way, you can get through it. So I hope you all learned something today, and thank y'all for being my audience.